This video is on the ever so hot topic, the piriformis. The piriformis originates and attaches on the front of the sacrum. So here's your pelvis, here's your sacrum. This is the anterior part of your sacrum. The piriformis, a lot of people don't even realize this, actually attaches on the front of the sacrum. And then what it does is it goes through this greater sciatic notch and attaches on the top of the hip bone. So if this is the acetabulum, the socket where the hip sits, the piriformis attaches right above that, 1 or 2 finger widths above that, runs through and attaches on the front of the sacrum. We also say that the piriformis originates from S2, S3, and S4. So if I turn the pelvis to the camera, the back of the pelvis to the camera, these bones right here, which you can see on a human being, are called the dimples of Venus. If you see those little dimples right there, and you come directly across, that's roughly S2. 1 bump below is S3, and 1 bump below that is S4. So if we turn the pelvis back around, you can see roughly on the pelvis where the piriformis attaches. So the piriformis originates from S2, S3, and S4, and then it goes and attaches on the top of the hip bone. Now, the piriformis is a strong external rotator of the hip. It also does give a component of abduction, so abduction, meaning the leg coming away from the midline. And I want everyone to remember this, that when the hip is above 70 degrees, the piriformis is no longer an external rotator, it now becomes an internal rotator. So just remember that, when the hip is above 70 degrees, the piriformis goes from being an external rotator to an internal rotator. Now, one key thing to remember is that there is a direct connection of the piriformis with the gluteus medius through what's called the Boysen's arch. And if you are going to stretch the piriformis, you should also think about stretching the gluteus medius. Now, whenever you have somebody stretch the gluteus medius first, and they feel like they get this deep pain in their hip, you may want to stretch the piriformis first before you go and stretch the gluteus medius. And in this video, I'm going to show you how to stretch the piriformis and the gluteus medius. And I'm also going to show you how to reinforce or strengthen the piriformis. Now, don't forget, the piriformis also does a component of abduction, and I'll talk about that when we're actually reinforcing or strengthening the piriformis. Now, when it comes to pain, if someone has pain at the level of the coccyx, the tailbone, we have to look at more of that pain coming maybe from the obturator internus. But if they have the pain at the level of S2 and S3, now we're thinking about more of the piriformis. Now what I want to do is I want to talk just quickly a little bit about sciatica. Sciatica can come from many different parts of the body. As a rule of thumb, if you have sciatica pain, if you have numbness, tingling, pins and needles sensation, pain down into the foot, so it goes all the way down your leg, goes into the foot, goes into the toes, goes into the top of the foot, goes into the heel, etc., you absolutely cannot rule out a possibility of some sort of lumbar pathology, like a disc bulge at L5-S1, L4, L5, etc. However, if the sciatica stops before the knee joint and it doesn't go below the knee joint, now in my opinion, it's a big question mark, and the sciatic pain can actually be coming from the low back, it could be coming from the superior gluteal nerve, it could be coming from the piriformis, because the piriformis rests over the top of the sciatic nerve. And on some people, the sciatic nerve actually pierces the piriformis. And actually, some people, you'll actually see that the piriformis, or the sciatic nerve, runs through the piriformis. So yes, the piriformis can cause sciatic problems, but at the end of the day, it's not the only cause of sciatic pain. Now, here's how we're going to reinforce and how we're going to stretch the piriformis and the gluteus medius. Now this is how we're going to reinforce the piriformis. Now typically whenever I reinforce a muscle, I always think about what its counter muscle is, and because the piriformis attaches to the anterior or the front part of the sacrum, I have to think about what attaches to the posterior part of the sacrum, and that's the superficial gluteus maximus. So we need to think about that muscle, but for right now, we're going to focus on strengthening the piriformis in a superficial format instead of deep. So superficially, I would think more about orthopedic issues, sport issues, things like that. And if I'm thinking about the piriformis deep, then I'm thinking more of visceral issues, like issues with the bladder, with the prostate, or with the ovaries, or with the uterus. Now, to strengthen the piriformis superficially, you have 3 angles. And so if I'm at 8, so if my thigh's at 90 degrees, if I bring my thigh to 80 degrees, that's going to work the inferior part of the piriformis. If I bring my thigh to 70 degrees, that's going to be more of the middle part of the piriformis. And if I bring my leg to 50 degrees, that's going to roughly be the superior part of the piriformis. So you have those angles. You have 80, 70, and roughly 50. And I'm thinking about the angle of the thigh. Now, if I stay at those angles, the piriformis is an external rotator. But I also have a little component of abduction. So what I'm going to do is I'm going to stick a little pad right underneath my knee, and whether I'm in 70 degrees, 80 degrees, or 50 degrees, I'm gently going to push my knee into the floor to get that little component of abduction. So what I'm going to do is I'm going to lie on my side. Now my top leg is my fixed leg. Now my top leg could either be behind my body like this, or I could actually have it up in front of my body like that. It doesn't really matter. It probably depends on your flexibility. I'm going to stabilize back here, lying on my side. My abs are tight, and I have my 3 angles, and all I'm going to do is I'm going to gently push my knee down into the pad, and I'm going to do a component of external rotation. So all I'm simply doing is I'm lifting my heel to the ceiling, heel to the ceiling, heel to the ceiling. So let's say that's my 50-degree angle. My next angle would be my 70, so I'm coming up a little bit higher. Same thing, I'm pushing my knee down into the pad, and I'm lifting my heel and doing my component of external rotation. And then I have my last angle, which is 80 degrees, and I'm doing the same thing. I'm pushing my knee down into the pad, and I'm lifting my heel to the ceiling. And that's how we reinforce the superficial part of the piriformis. This is how we reinforce the piriformis deep fibers. Now, to reinforce the piriformis deep fibers is an amazing exercise, especially for people that have had issues with the pelvic diaphragm, and especially for women who have had children, and especially if they've had an episiotomy. I think this is an extremely important exercise to do. So this is the deep fibers. This is more of a semi-closed chain type of movement, where you're going to see that I'm going to have 3 different fibers again. If I go ahead and I go back on my elbows, that's going to be more of the superior fibers. If I prop myself up and I bring my torso at a 45-degree angle, that's going to be more of the middle fibers. And if I go straight up and down like this, that's going to be more of the inferior fibers. Now, the leg that we're going to reinforce, what we're going to do is we're going to bend that knee a little bit. The straight leg is going to be in line with the body, and because this leg is fixed, I want to internally rotate my femur, pull my big toe toward my nose, and now I want to take my left leg, this is the one that we're going to reinforce, and I'm going to bring it out to the side just a little bit, and if I was able to drop my knee down and put it next to my other knee, that's roughly where my foot would go. Now remember, in this degree of angles here, we're talking about external rotation. So you're going to use a band, or you can use a cable machine, or you can use somebody's resistance, but you would take a band and you'd put it around the upper part of the thigh, and you would tie off the band to something that doesn't move. Or again, somebody can use manual resistance here, or you can put yourself in front of a cable machine and put a strap around your thigh. Now, Remember, we have our angles, we have back on the elbows for superior, we have our trunk at 45 degrees for middle, and then we have completely vertical for inferior. And what I'm gonna do is I'm gonna fix my right leg, internal rotation, pull the big toe toward the nose. I'm going to gently push my left sit bone down to the floor. That's really important to have a fixed point. And basically what I'm gonna do is I'm gonna externally rotate, externally rotate, externally rotate, externally rotate. Now, I'm just demonstrating this for the camera up in this position here, because if I go back and do the superior fibers, I can't hold on to the band. But you'd be doing the same thing whether you're doing the superior fibers or the inferior fibers. You're working and going into external rotation. Now, how far do you come in? You can let your knee come in as far as it will go, as long as that ischial tuberosity or that sit bone on that same side does not come off the floor. And again, you're thinking about that component of external rotation, and that's how we reinforce the deep fibers of the piriformis. Now, I talked about the opposite fiber of the piriformis, the opposite muscle fibers, and that's the glute max superficial. Now, this is not mandatory to do when you're strengthening the piriformis, but I want to have this particular exercise in your back pocket, again, because this is just on the opposite side of the sacrum. So to do the superficial fibers of the gluteus maximus, it's a little bit like the deep fibers of the glute max. So on the deep fibers, if you remember back to my previous videos, we had knees together, feet apart. We had knees together, feet together. We have feet apart, knees apart. And then we have feet together and knees apart. And they all just simply, you flatten your back to the floor and you drive the earth away from you, squeezing your glutes at the top. It doesn't matter whether you're like this, like this, like this, or like this, it's all the same. To do the superficial fibers, so if I want to do the superficial fibers of the glute max, all I do is I take that leg, my left side, if I want to do the superficial fibers of the left glute max, all I'm going to do now is I'm going to keep my knees where they're at. I'm just going to straighten my leg, and so I'm on my heel. And now in my brain, my back is flat. I fire my heel into the floor, my left heel into the floor. I'm driving my left heel into the floor, up, down, up, down, up, down. And you can always work with different fibers. So if that was the lateral-most fibers, I could then go ahead and I could switch my legs here and then straighten my legs out, drive the heel into the earth, come up and down. If that's more of the lateral medial fibers, then I could go here for more of the medial lateral fibers and then straighten my leg, drive the heel into the floor, drive the heel into the floor. And then I could go medial, which is this position here, and now drive the heel into the floor, drive the heel into the floor. And that's all part of the superficial glute max. And that's how we reinforce the superficial glute max if you feel you need to do that to counteract the superficial fibers of the piriformis. Now that we've done the reinforcement of the piriformis, this is how we stretch the piriformis. I'm going to show you two different stretches. I'm going to show you the superficial stretch and then the deep. Or maybe we could call it even more of the distal stretch and then more of the proximal stretch. So to do the distal stretch, which again would be more for orthopedic type issues, you're going to sit on your butt. You're going to go ahead and bring your hands behind you. And again, we can either go on our elbows, we could prop ourselves up in that 45 degree, or we could come straight up. What I'm going to do is I'm going to stretch my left one for the camera. So I'm going to bend my left knee, and I'm going to bring my foot out about as far as it will go, where if I let my sit bone roll away from the floor, I could drop my left knee down toward my right. And I'm going to sit back up again. Now, because we're stretching the left side, we got to fix the right side. So I'm going to internally rotate my femur, pull my big toes to my nose. I'm going to erect my spine. My chin is in, my eyes are down. And if I'm in this position here, it's more of the middle fibers. Remember, if I'm going back on my elbows, it's more of the superior fibers. If I'm up here in the myofascial stretch position, it's more of the inferior fibers. Again, you can pick and choose. But basically what you're doing is in your brain, you're pushing your left sit bone down into the floor. And now you're going to drive that left knee down towards your right knee. You're driving it in an internal rotation because remember the piriformis is an external rotator. You're going to hold and breathe for 30 seconds. When the 30 seconds is up, you're going to slowly relax. And again, you can stretch that in different angles. Typically, you're going to stretch each muscle for 3 times. The first time just kind of feeling it, the second time going a little bit harder, and the third time going a little bit more. Now, if you want to stretch the piriformis more deep, it's going to be just the opposite action. Now, again, I want to fix this leg. I literally want to now anchor my left knee down to the floor. Now I'm going to prop myself up really tall. And now in my brain, I'm trying to push my left sit bone down to the ground. If you get too much of a pull in your medial collateral ligament, just bend that knee a little bit more. And now as you're going tall, in your brain, you're trying to get that left sit bone closer and closer to the ground. You're going to hold and breathe for 30 seconds. Again, try to do each one 3 times. Now, in the beginning of the video, we talked about the link between the piriformis and the gluteus medius. So now I'd be remiss if I didn't show you how to stretch the gluteus medius. So if I want to stay with the same side, the left side, if I want to stretch the gluteus medius, I want to fix my right side by turning my knee in, pulling my big toe toward my nose, bring this leg up across my body, and now it's mandatory to push my left sit bone down to the ground. I can hook my arm around that knee, and now in my brain, I'm driving my right knee across my body. I can add the fascia of LeBlanc, the fascia of the upper of the lats into the equation, spread the fingers, pull the wrist back, or I can simply hug that knee, push that left sit bone down, and keep driving that knee across my body. Hold and breathe for 30 seconds, and again, repeat that 3 times. By stretching the gluteus medius, remember, they're in link through that Boysen's arch, and sometimes that's really important if you want to have an impact on the piriformis. And this is how you stretch the piriformis.